Church was formed. In 1930, there were at least 12 states that outlawed the use of peyote. Across the ocean in Italy in 1931, a guy named Dr. Baroni started using mescaline as an adjunct to psychotherapy. 1953 and 54 saw the publication of Aldous Huxley's Doors of Perception, which of course is Aldous Huxley's first-person account of using mescaline, and he gives some pretty detailed descriptions of his experience. It's a good read if you have some time. In 1960, the federal government gave Native Americans legal access to peyote, which was good because in '67 they banned everybody else from using it. The use of the ergolines now, mainly because this is the only example of hallucinogens being used ritually in the ancestors of Western European civilization. Starting in 1500 BC and lasting until about 300 AD, when again the Christians started getting more heavily involved in Roman politics, there was a ceremony called the Eleusinian Mysteries. This was an annual celebration to honor the goddess Demeter, who was the goddess of the fields and of grain. There was a pretty exclusive invitation list in its 1800 years of life. Attendees at this celebration included people like Homer, Cicero, Aristotle, Plato, Sophocles, Pindar, and Aeschylus. And they would get together for 2 or 3 days and they'd drink something called kykeon, which, judging from what has been written about this and what has been described, was probably a grain-based brew whose hallucinogenic properties were derived from rye ergot fungus. Now we hop ahead a few hundred years to 1943, when a chemist named Albert Hofmann was synthesizing rye ergot derivatives for use in medicine. On April 16th, he accidentally ingested LSD-25, an agent he developed as a blood stimulant for Sandoz. 3 days later, he purposefully ingested LSD, about 250 micrograms. And again, he wrote a really nice account. He went for a bike ride. He rode his bike from like work to home, and to him it took about 5 years to get there. Again, really entertaining reading. So it didn't take too long for the CIA over here in the US to find out that LSD was around and that it had some pretty profound effects on the human mind. So in 1953, the CIA started their MK Ultra experiments. Now these were not experiments in the usual sense that we think of them these days, because these days, we insist on these things like consent to participate in experiments. The CIA was going around and giving people LSD without their knowledge. That actually resulted in 1 or 2 suicides. So finally in '63, that kind of stuff was shut down. While the CIA was goofing around, Tim Leary started some more legitimate research work at Harvard. 1962 came around, and once again Congress started hearing about this LSD stuff and thought that, well, if it's powerful and can be used as a weapon, then we should probably start putting restrictions on it. 1963 is when black market LSD started hitting the streets and the college campuses. It was that same year that Tim Leary was fired from Harvard. He later went on in 1966 to found the League for Spiritual Development, which was based in Millbrook, New York. And by 1970, 1 to 2 million Americans had used LSD. And that leads us into talking about the clinical trials of the 50s and 60s. Back between 1950 and 1960, Stahl, Osmond, and others were using LSD as adjuncts to psychotherapy. Osmond's first reason for doing this was kind of unusual. He was treating alcoholics, and he had noticed in his clinical work that the alcoholics were most likely to abstain permanently from alcohol were those who had been through very violent and severe DTs. So he saw LSD as a way of recreating the DT experience in a safer way than actually putting somebody into DTs. So where things sort of fouled up for Osmond is that he gave his patients the LSD and really tried his hardest to make them have a really bad experience to scare them into not drinking alcohol again. But most of the patients had very positive experiences. and also had tended to have a sort of shift in their paradigm, a shift in their thinking and in their perspective on their drinking, to the point that the subjects who were given LSD tended to do a little better in terms of remaining abstinent than the people who didn't. 1960 came along, and Cohen at UCLA published a safety paper on LSD. They looked at 5,000 subjects who collectively had taken 25,000 trips. So some pretty good numbers. Per 1,000 LSD ingestions, there were 1.8 psychotic episodes, 1.2 attempted suicides, and 0.4 completed suicides. Those numbers led Cohen to declare LSD an astonishingly safe drug, and that opened the doorway to more human clinical experimentation. One of the most well-known experiments is the Good Friday experiment. It was conducted in 1962 by Walter Pahnke. He took 20 theology students who were psychedelic naive, who had had mystical experiences in their past at some point. He split them into two groups. 10 of them received psilocybin, a pretty healthy dose, and 10 got an active placebo. They got nicotinic acid, which, if given at a high enough dose, causes some tingling and some physical sensation, but isn't, as far as I know, a psychedelic. Gave them the psilocybin and active placebo in a very supportive religious setting. They actually did this in a church. And when all was said and done, 4 out of the 10 people in the psilocybin group had had a mystical experience that day, whereas none in the placebo group had a mystical experience. Later on in 1991, Rick Doblin of MAPS did a follow-up study and talked to most of the people who'd been involved in the Good Friday experiment. And it turns out that most of them from that day had had long-term benefit. Either it had changed some aspect of their relating to God, or or their conception of their religion. And none of the people who received psilocybin had any long-term negative effects. Next was the Concord Prison Experiment, also pretty well known in the literature. This was run by Tim Leary in 1961 through 63. What he did was he did psilocybin-assisted group therapy with prisoners, and his goal was to reduce recidivism. So what they did, they had 12 group sessions over 6 weeks, and for 2 of those sessions, the prisoners received psilocybin. I think also the facilitators took psilocybin. Research was a little different back then. But Leary, in his paper, reported significant improvement in the prisoners' recidivism rates. But later on, again, Rick Doblin did a long-term follow-up study and found that the improvement wasn't as great as Leary had said, and was in fact non-significant statistically. And finally, we come to the Spring Grove experiments. Spring Grove was a state hospital in Maryland, or is a state hospital in Maryland. I actually went to their website, and they had a history of Spring Grove from its, they founded it back in 1600, 1700, and there was no mention of Stan Groff and Walter Pahnke doing these LSD experiments in their hospital. I can't imagine not wanting to talk about this in public. But anyways, so Walter Pahnke and Stan Groff and others in 1963 started the Spring Grove experiments. These were NIMH funded. They received $4 million to conduct these experiments. They gave LSD to alcoholics and addicts, and that of course was based on Osmond and others' experiences with using LSD in treatment of addictions. They also gave it to neurotics and terminal patients. Note those last 2 groups, an endpoint is difficult to define, but in the addicts they did see a significant reduction in relapse rates. The same kind of work continued at both Spring Grove and at the Maryland Psychiatric Research Institute until it finally shut down in 1977.